It's Testosterone Thursday again with Dr. Ray from Olive Branch Wellness Center. We're having some personal technical difficulties today, a little bit of a squeaky voice, so if I squeak in and out, just know that it'll pass, and next week we won't have those problems on Testosterone Thursday. So men, you know, as you get a little bit older, you get a few more pounds on you, and that has a lot to do with your testosterone levels. So what happens is if we don't have enough testosterone in you guys, the testosterone is easily what feeds the muscles. Muscle mass is always more desirable, right, than fat mass. So when you begin to lose your testosterone, you begin to lose your muscle mass. That's scary for you guys because it's about, you don't look as good maybe as you think you should. But the other thing is when you lose muscle mass all over, not just one small muscle. You lose it all over, and losing it all over also means you lose it in some of the muscles that'll help stabilize you. So in those stabilizing muscles, I'm talking about things that help keep you from falling, give you the great balance, keep you being able to wash your feet in the shower so you don't, fall forward and bonk your head. Also the muscles, the tiny little muscles that run along the spine and the back. So if you're not getting enough testosterone, not making enough, or don't have enough, let's put it that way, the muscles can start doing something not so cool, which is cannibalizing themselves. The body needs enough protein to run on, so the muscles then start breaking down each other to give the body protein to run other functions. So no testosterone or very little testosterone means there's very little for muscle growth. Now, when there's very little for muscle growth, and you're saying, but my pants are still the same size, my shirts are still fitting the same, that means something horrible. That means, not horrible, but that means that your body has replaced the muscle with fat. Now, I know I don't have to explain the difference between muscle and fat, but that's definitely not good. We'd rather have you more muscle bound than fat bound. So professionally speaking here, I also want to see that as you go into your 50s, your 60s, your 70s, your 80s, you have the muscle to move everything up and down. So move everything up and down is something like going up and down the stairs. A lot of people lose their flexibility because their muscles are in such bad shape. And they're in bad shape because they've been degraded. So things like we laugh and we say, man, as you get older, you don't have a butt, your legs just end. Well, your legs just ending means you don't have any glutes, glute max, glute medius. So when those are missing, it also makes it harder to go up and down the stairs. You use a lot of those muscles along with your leg muscles. So you can see how then you're a trip and fall risk, and you're thinking, good Lord, I'm only 50, or I'm only 60, or maybe you're only 70. You should still have good quality testosterone, good quality muscle usage. So if you're thinking you're getting a little clumsy lately, or you've noticed that, you're not seeing your muscle tone through your skin like you were, you're maybe seeing a little bit more fat, let's get your testosterone tested. So there's a functional value and an optimal value for testosterone. Make sure you're seeing somebody that's a natural health care provider or a naturopath to get that checked, because we want you to be at optimal performance. There's absolutely no reason why a man in his 50s, 60s, 70s, or 80s should not be able to do all the things he still wants to be able to do. And that means going to the gym, yes. But if you're degrading your muscle, and you're switching off muscle for fat, we don't want to see that happen. So this is Dr. Ray from Olive Branch Wellness Center on Testosterone Thursday. Join us next Thursday for another exciting 4 or 5 minutes of information from me. And remember, I don't watch sports, I only watch hockey. See you guys later. Have a great week.